We'll now move on to our third speaker. The third speaker is from China, Professor Cindy Alil, who's going to talk to us about high-intensity focused ultrasound. It's important to know that high-intensity focused ultrasound had many of its origins in China, and the doctors in China have become absolute experts in the use of HIFU, and it'll be very interesting to hear Professor Cindy talking. I have to say to you that we've had to record her lecture, which will be now broadcast due to some technical issues, and not least also because it's 3 o'clock in the morning in China. So if I could ask for Professor Cindy's talk to be uploaded now. Thank you.
Hello, ladies and gentlemen. It's my great honor to be here to share some information about how to treat adenomyosis. My name is Cindy Ali. That is my Chinese name. I am Chinese Uyghur, a little bit similar with Turkish. So I have a Turkish name, Galbnur, and I also has the English name, Cindy. It's more convenient for the friends to call me. So I'm from the First Maternity and Infant Hospital. So about adenomyosis, we will review the simple history. The first person we should know is Carl. So in 1816, the first adenomyosis was found by him. The second person is Thomas. The third one is Simpson. We also know the world father of adenomyosis is him. So he found the first chocolate cyst and other very important medical term from endometriosis disease. So adenomyosis is a widespread disease affecting the reproductive period of life. Its prevalence is up to 70%. Sometimes the diagnosis should be very difficult because some of the patients know any symptom. For pathology, up to now is not really clear, but the very important mechanism pushed by colon in 1908. So basal endometrial invasion. Other theories include invasive tissue growth, developmental origins, uterine inflammation related to childbirth. As we know, in China, we had a one-child policy before, so their prevalence of artificial abortion is very high. So we did some simple research about the adenomyosis. So the artificial abortion to some extent related with adenomyosis. Another reason is stem cell origin. Stem cell also a very popular research during the recent several years. So this map we can see the very complex mechanism how the adenomyosis and the endometriosis happen. So we are mostly focused on the estrogen-dependent mechanism. The clinic feature about adenomyosis include heavy or prolonged menstrual bleeding, severe cramping or sharp knife-like pelvic pain during menstruation. So different kind of pain, including dysmenorrhea, dyspareunia, is sometimes very heavily affect the woman's sexual life. The third is chronic pelvic pain, and another big problem for many ladies is infertility. And also we can find enlarged uterus, and up to 40% patients coexist with chocolate cyst, and 50% patients coexist with uterine myoma. So sometimes we will say to patients, chocolate cyst and adenomyosis just like twins. Here's some sonography about adenomyosis. So from ultrasound, so we can easily detect it. The myometrium extend with heterotopy endometrial tissues. From MRI, also we can find irregular sticking of the junctional zone. So the junctional zone, the thickness, also the very important key point to diagnose adenomyosis. Another one is abnormal thickening of subendometrial myometrium. Here is some pathology, the tissue from our operation and the other researchers' operation. So we can say there's some endometrial island tissue. About treatment, so include medicine like anti-inflammatory drugs, oral contraceptive, GnRH-a, also a very popular treatment recent several years, and Marina, we call it a very magic IOD to treat some of adenomyosis. And another one is gospel center, actually, which is a very ancient medicine used for men's fertility to prevent pregnant. And others include some Chinese herb. Second therapy include the uterine artery embolism. Some of the researchers had very good research about this. Third is surgery, include the radical operation, means take the whole uterus out. Hysterectomy, but hysterectomy is not suitable for the women who want to have a child. Another surgery is conservative operation, include adenomyomectomy and uterine artery embolism and endometrial ablation, and another one is uterine nerve ablation. The first treatment exactly is the techniques we will introduce today is HIFU ablation, high intensive focal ultrasound. So this technique actually is very simple. So we will see from this picture. So patient usually lie on the treatment bed, then the ultrasound can penetrate the skin tissue and focus on the middle of the lesion, especially myoma or the adenomyosis. So we call this high intensity focus ultrasound is non-invasive, any needle, shorter hospital stay, and the faster recoveries and better quality of life. Many of the patients like this. So first step is clean the belly, and the second step is we will evaluate the lesion, the area, the location where the lesion exactly is, and through the vascular supplement to determine the intensity treatment area. And the third step is ultrasound-guided HIFU therapy. So this is through ultrasound, we can manipulate the size of the lesion. And next, so we will find the Greyscale change inside of the lesion. And then very important part, we will use the sonogram to evaluate the ablation area. So sonogram always making a very important role during the treatment of HIFU. First, can evaluate the area of ablation. Second, can enhance the ablation effects of HIFU. So usually we use 3 steps to treat adenomyosis. The first is HIFU. Sometimes if the patient has chocolate cyst, we will combine with operative laparoscopy after HIFU. The second step is use GnRH-a. The third step, just for the long time administration, we will use Mirena to prevent the recurrence of adenomyosis. We will share some typical cases. So from this picture, we can see the area of the adenomyosis, and the right picture is the ablation area after HIFU. So we can see nearly 80% ablated by HIFU. And for third step, when we put Mirena inside of the uterine cavity, usually we will use diagnostic hysteroscopy. So we can see in the left picture, inside there's some tissue. In right picture is at the after curettage, so we clean the whole uterine cavity and then put Mirena inside, can reduce the spotting after surgery. So for the pathology results, so we can see higher grade degeneration. It also the evidence to clarify the effectiveness of HIFU technique, and also we can exclude the malignant pathology. So this is a picture. So before treatment, we can see posterior area. This is adenomyosis. The second picture is 1 day after HIFU. For the third picture, we can see after 80 days, the uterus shrink to normal size very dramatically. So we did some research about the VAS and VRS, so we can find after HIFU treatment, the patient's pain can relieve dramatically. From this figure, so we can see menstrual volume score compared before and after HIFU treatment also reduced. From third figure, so we can see, especially for the anemia patient, the HIFU treatment can help to improve the hemoglobin. The first figure, the uterine size, also can reduce dramatically. The fifth figure, so we can find a very important marker, CA125. It can be gradually reduced to normal level. So here is our HIFU family team. So here I want to thank to all the organizer here. So I hope my message can help you get some information about HIFU, and also sono will play a very important role during our treatment. And thank you all of you, and welcome to Shanghai. Thank you too much.
Will join us for the next webinar session, and if you go onto the website, you'll see when that is. Thank you very much for your participation, and good evening to all of you.